Hi, beautiful people. It's Wonderful Wednesday. I'm April Roll, your ER doctor online, and March is National Colorectal Cancer Awareness Month. So, in this video, I'm going to be explaining what colorectal cancer is, some of the symptoms, and screening, and what you can do to figure out if you are at risk or if you may be developing colon cancer. So stay tuned if you want to hear about those things. So, first things first, what is colorectal cancer? It's cancer of the colon or rectum or both. What does that mean? The colon is the large intestine of the bowel. The rectum is the tube that connects the large intestine or colon to the anus or the hole that the poop exits out of. Okay, so colorectal cancer is cancer of the large intestine and the tube that brings the poop from the colon to exit the body. In terms of who colon cancer affects and how it starts and things like that, most of the time colon cancer starts from a polyp in the colon, and that abnormal growth just kind of degenerates or transforms into abnormal tissue and or cancer. A polyp is something that could be found. If you have a polyp, it could be found during a routine colonoscopy. That's how most cancers can start from a polyp. Not all, but most. In terms of who is at risk or who does it mostly happen in, when is the incidence higher, it's mainly in the 50 and older group. Now, that does not mean, obviously, as you may know or you may have already heard, that does not mean that if you are under 50, you cannot get colorectal cancer. Anyone, male or female, young or old, can get colorectal cancer, and that is why Colorectal Awareness Month, Colorectal Cancer Awareness Month is so important, so that you all can learn the symptoms and what you can do to be screened in order to protect yourself. Because the earlier that colorectal cancer is detected, the better. It is a cancer that is very treatable, especially with early detection. Now, I'm going to go over some specific symptoms that you want to look out for. So, if you are having those things, you definitely want to see a doctor and get further evaluation. So, first up, have you seen a change in your bowel habits? What do I mean by that? Are you every so often you're having a lot of diarrhea, or you're having a lot of constipation, or you're having diarrhea now, or you're constantly having constipation now, or your stools are a lot narrower than they used to be? And that brings me to a side note, because in the hospital, when I'm asking my patients about what they're seeing in the toilet, what color is your poop, what, is it, are you having watery, soft, hard, is the blood mixed in the stool, or is it on the toilet paper, things like this. If the person is having blood in their stool. And commonly the answer to my question of what did your stool look like is, I don't know, because I don't ever look at my stool. Now, I know this topic of, talking about your bowel movements and things like that is not something that people typically do or want to do, but it is very important to look into the toilet. I'm not saying get your face in it. Just turn around, look at the toilet, see, does it look normal, or has there been a change, a very drastic change from what is normal for you? Okay, that I just want to put that out there. Start looking at the toilet after you use it. That goes for urination as well, peeing as well. Look at the toilet. Is your urine yellow, clear, dark? Does it have blood in there? Things like that. These are things that you need to know. But back to what we're talking about, okay? Next symptom. Do you have persistent abdominal discomfort? Now, by this, it can be straight up pain or a lot of gassiness, a lot of bloating, some discomfort, cramping. Are you now having a lot of abdominal discomfort out of nowhere? Next symptom, do you have rectal bleeding? I just, kind of mentioned this before. Are you having blood in your stool? Is the blood, like I said, is it mixed into the stool? Is it bright red? Is it dark black? If you're seeing dark black substance in the toilet, that is probably blood. If you're not on heavy, iron tablets or taking a bunch of Pepto-Bismol. If you're seeing a new change of black stools, that's likely blood. Or if you're seeing a dark maroon color, that's still blood. Next symptom, do you feel weak or fatigued? You're all of a sudden you're getting really tired, and that may also be accompanied by anemia or a low red blood cell count. That could also be a symptom. Next, are you having unexplained weight loss? No reason at all. You're not exercising, you're not dieting, you just all of a sudden are losing weight. And also maybe you're having symptoms of nausea, vomiting, loss of appetite, that go along with that symptom of weight loss out of nowhere. These symptoms that I've listed, the change in the bowel movements, blood in the stool, abdominal pain, feeling weak or fatigued, unexplained weight loss, these are all a change from your norm. These are all symptoms that can send kind of like a red flag, like, oh, I need to go to the doctor and get checked out. Now, in terms of getting checked out, there are many different options for screening. And so I'm going to put a link in the description box below. One's going to be just for general information, and one is going to be for different options for screening. But please, if you have any of these symptoms, or you have a number of the symptoms that I just listed, you definitely should get hooked up with your doctor. If you don't have a doctor already, go into a clinic or some type of medical facility where you can get hooked up with a doctor in order to have further evaluation of your symptoms and get evaluated for colorectal cancer, especially if you have a high family history of colorectal cancer, but also if you're the type of person you just don't go to the doctor, or if you're over 50. Like I said, the incidence is higher in people over 50, but it is not excluding people under 50. So it's really important to know your body, pay attention to these symptoms, seek medical attention if you have any of these symptoms so that you can get screened, because like I said, the earlier that you detect colorectal cancer, the better the outcomes. And this is a very treatable condition. If you learned anything from this video or you like this video, please share it with someone. If you want to suggest any comments or topics to talk about on future Wonderful Wednesdays, please list those in the comment section below. Thank you for sharing this Wonderful Wednesday with me. Be blessed and stay healthy.